Hi, I'm Dr. Robert Reese. I'm a vascular and general surgeon by training, but since 1999, I've been performing hair restoration procedures on men and women, even some children. It's been extremely gratifying for me personally as well as for the patients. I am a past president of the American Board of Hair Restoration Surgery, past fellow of the International Society of Hair Restoration Surgery. I'm located at the Bee Caves location. This portion of the presentation is a video, but I'll be live with you at the end of this presentation to answer any and all of your questions. We've included a comment and question box. Hopefully you see that below. If you have any questions that you'd like me to answer for you live, I'll be happy to do so. Just enter your question and we'll take care of that at the end of this presentation. Throughout history and across cultures, our hair is an important symbol of who we are as individuals. Our hair is associated with youth, health, vigor, attractiveness. To lose our hair is very difficult for people. And although there are other options, for example, toupees, wigs, non-surgical options like platelet-rich plasma, for example, for most patients, those will have mild to moderate benefits. What I do, surgical hair restoration, offers people a permanent solution to have their natural hair back in the position where it looked at an earlier time in their life. It's a very healing procedure for people. It makes them feel whole again. People ask me all the time, what's the hardest part of having a hair transplant? And the true answer to that question is taking that first step and coming in for a consultation. That is the hardest first step. But doing so is so helpful for the patients. They can explain to me what their concern or their concerns are. I can do an evaluation for them. Once I understand the patient's vision, I can create a hairline for them to consider. I walk them through the process, and it's extremely informative for them. In having that interaction and the consultation, you also get a feel for each other and make a determination whether we'd be a good fit or not. I don't charge for my consultations. I think it's a really important step to create a surgical plan for someone that's really going to work well for them. Trust me, it'll be well worth your time to consider having a consultation if you're concerned about an issue with your hair loss. Everybody in my hands looks natural. Naturalness is the least of your concerns, but everybody wants more density. They love the result. And when you really love something, you want more of it. You want to be around it more. And with hair restoration, it's the same. Everybody wants more hair. Some people will end up having a second procedure, but probably 75% of the patients that I transplant, I only do one procedure on. I can get them from where they are now to where they'd like to be, and then they're on to bigger and better things. So when I'm performing a procedure, the patients are wide awake. When we do a hair transplant, we select the follicles from a zone where those follicles are resistant to miniaturization, where the hairs are lost over time. So the follicles that we transplant for the rest of your life will grow hair, just like the hair grows on the back and the sides of the scalp now. A hair transplant surgery, as long as permanent follicles are being harvested, is expected to be for the remainder of your life. It's one of the big benefits of the transplant procedure. We perform that type of extraction work and we perform it very well, but it's a slow process. It'll take anywhere from, depending on the individual, 3 to 6 hours to extract the number of follicles, and we have to have very short haircut to perform that type of a procedure. With the traditional method, with the strip method, or FUT, they call that procedure, we do that with long hair. So there's very little noticeability, even though we've done the hair transplant procedure on those patients. A newer technique is where we individually remove each follicle one at a time. That's called follicular unit extraction, or FUE. Here we have several of the follicles that I just extracted using the follicular unit extraction technique. One at a time. It's kind of a slow grind, but we just take the time that we need to get good follicles. Each follicle will then be placed into one follicle, into one of the tiny little nicks that I made in the recipient pattern. And ultimately, that'll all grow in and reestablish the frontal hairline for the patient. And for people that need large procedures, I combine both techniques, both extraction techniques on the same day at the same time with long hair. I call those combination procedures, or combo procedures, as far as harvesting. And we can do very large numbers for those patients who will benefit from them. Everything heals beautifully, no issues. People will ask me, is it painful to have the hair transplant? And the answer is no. I have not written for a narcotic analgesic for one of my hair transplant patients in many, many years. I use a non-narcotic discomfort medicine. The patients will use that, depending on the procedure that was performed, for 1 to 3 days. And nobody believes me on that, but it's true. They don't have discomfort. And I include a cool pack intermittently. And people will use the cool pack for a day, maybe 2. That's it. So people find that actually having the procedure it's a long day, but it's a much easier day than they thought it was going to be. But there's always a hard part to everything, and the hard part with the hair transplant is that it's not an immediate result. It slowly comes in, starting to come in 6 to 8 weeks post-procedure, and then it grows in like with baby hairs, and it slowly gets better and better over the course of a year. Then the hairs develop and mature and grow, and they look, and they're representative of the hair that you have on the back and the sides. That's actually one of the benefits of the procedure, because nobody's going to know that you had it done. It just slowly gets better and better and better over time. If you're on any medicines, we'll review those medicines with you to see if we want you to stay on them or not. In most cases, we just have the patients stay on their existing medicines. There really isn't anything else to prepare for other than we encourage you to have a nice breakfast before you come in on the day of your procedure. We'll get you some lunch to eat later in the day, but it's nice to have that good breakfast on your stomach before we start. It's just comforting. Otherwise, as I said earlier, you're wide awake for the procedure. There are points during the procedure that we encourage you to listen to music or watch a movie or two as we're doing our work. Although it's a long day, we actually have a lot of fun when we do the work with the patients. We want you to be as comfortable as possible, so we'll work with you. What is the recovery like after a procedure? For people that have the follicular unit extraction procedure, because we had to take all the hair off, there's going to be some visible redness to the scalp that we transplant into. Typically, that's noticeable for 7 to 10 days. It's not so much the redness that's noticeable, it's the crusting or the scabbing that develops from the tiny little openings that I create to place the follicles in. And I have a very simple strategy that I outline for people that assists them in eliminating those crusts as soon as possible. Typically within a week, 90% of the crusting is off the scalp. And then it really isn't so noticeable that you had a procedure done. It just looks like you got a short hairstyle. And once the hair grows in over the next 4, 6, 8 weeks, then, it's like nothing happened. People will ask me, who's the ideal candidate for a procedure? There really isn't one. Some of the people that I've taken care of that have the most hair loss are some of the easiest people to take care of. They're so enormously grateful that they have a hairline reestablished and some hair across the top of the scalp. Some of the most challenging people are the ones that had the wonderful hair in their youth and that slowly faded away, and they remember how it used to look. So we have to do very dense patterns on them to reestablish that type of a result. They get fantastic results. Almost all I only transplant one time, and they're appreciative. But again, some of the easiest people are the ones that have the most hair loss. They're just extremely grateful that we were able to achieve a result for them. So I think that one of the important things that a prospective patient needs to consider is what actually is the role of the physician. And for me personally, here's my role. I perform your consultation. I design your hairline. I mix and administer your anesthetic agents. I create the recipient sites. My team dissects tissue and places tissue. I participate in the follicular unit extraction along with my team. So I'm very involved in my hair transplants. I'm skilled in all aspects, and I'm heavily involved in your procedure. At most facilities, you will not find that same level of care. Something that you'd need to ask about specifically to get a good understanding. People want to understand what's the pricing of a hair transplant. And I find it most appropriate to do standard pricing. One thing that I've never felt comfortable with throughout my career is charging a price per graft, because it always seems like there's additional grafts that the patients have to pay for at the end of the day. With me, it's a flat fee. If I determine that you need more follicles than I felt that I was going to need at the time of your consultation, we're going to transplant those for you, but there's no additional fee. I'm not the most expensive hair transplant surgeon, but I'm not the least expensive hair transplant surgeon. I charge a fair fee for my work, and I've delivered results for my patients since 1999. Be happy to meet with you and get an idea of what your goals are, and then we can work together to see if I'm able to create the design that you're hoping to achieve. But the best way to get answers to those questions is let's just get together. I think you'll find it super helpful and very informative. Thank you. Hello, I'm Dr. Bob Reese, and I'm joined with one of my consultants, Avery Stevens.
Hi.
And we'd like to answer any and all of your questions. Fire away.
Okay, first question we have. I started losing my hair at 19, 30 years ago, and in response began doing a vigorous daily scalp massage, which I believe has mitigated my hair loss considerably. About how long would I have to refrain from scalp massages after getting a transplant done?
For most patients, the follicles are secure in their new location within about 5 days. If we were going to do scalp massages post-transplant, I'd probably recommend, just to be on the safe side, about 2 weeks. But you'd be able to get back to your normal routine in short order.
Okay. Next question. In your view, is finasteride pretty much required after a transplant?
So that's a great question. And hair loss is what they call progressive, meaning that we start out with a full head of hair and slowly over time, we slowly progress and lose more hair. when I do a transplant, if somebody were completely bald and we were going to transplant them, there really wouldn't be much of a need to use something like finasteride because they've already lost all the hair that they're going to lose in their life. But for many people, they're in some portion along that progressive line of hair loss. And it's important to the patient and it's important to me for the patient, if at all possible, to get them their result with one well-performed transplant. And I can do that on almost everybody, but I really encourage them to stop ongoing hair loss. Now, they can consider medical options like finasteride, oral minoxidil, topical minoxidil. Some people use a medicine called dutasteride. Uh, they can use non-medical options like low-level laser therapy. And I'm comfortable with any of those options as long as the patient and I have a plan that we can institute that minimizes the likelihood that they're going to feel the need to have a second transplant because they've experienced more hair loss over time.
Okay, next question. How is the hair transplant process different for women? Do women need to shave their head?
So that's a good question too. I transplant probably 15 to 20% of my cases are women. And most of the time, women will come in and they'll say something. It's always about density for women. They'll say, my ponytail used to be this big and now it's this big. So in most instances, women are seeking more density. And interestingly enough, going in and doing very large transplants on women is not always a great idea because women don't come in bald. They're thinning, maybe, but they're not bald. And you can experience short-term thinning of their natural non-transplanted hair early post-transplant. So I have strategies that I employ where we can perform a density procedure on them, but maybe dissect the tissue a little bit differently. So it's a smaller total number of grafts that moves the most amount of hair for them. Some women, the second most common pattern of female hair loss is where they'll recede in the temples and they'll want me to reconstruct a female hairline. I just did one on a very nice lady probably 3 weeks ago. It's going to completely change her life. But most commonly, women end up seeking a density procedure. We don't, whether we do follicular unit extraction or the strip method or a combination procedure, it all depends on what the plan is. But because women wear their hair with length most of the time, we don't typically shave their head.
Okay. Next question. Is it possible to take hair from the back of the neck or another part of the body to transplant to the scalp? Or is it always taken from the back and the sides of the scalp?
So the area where we have the most density of follicles is in the occipital-parietal scalp and through here. And body hair transplants were popularized a number of years ago, and many of us tried them. But the quality of the hair, the way the hair grows, the length the hair grows in other parts of our body is not the same as what grows on our scalps. And so where that became popularized a number of years ago, it never really took off among the hair transplant professional community. So it's an option to consider body hair transplant harvesting, for example, but it would really only be utilized if the permanent donor zone on the back of the scalp was completely exhausted.
Okay. Post-transplant, what is a realistic percentage of original hair density at the front of the hairline?
Okay, I think I understand what you're talking about. And you may have heard the statement that we really don't look like we're starting to thin until we've already lost 50% of our hair. And so with a hair transplant, you try and approximate to the best of our degree, getting as close to that 50% density level as possible, because then it's going to look like normal density that we transplanted. One important consideration that needs to be taken into account is something called color contrast. And it's something that we discuss in the consultations, meaning that people that have wide color contrast or wide separation of color between the color of the hair and the color of the scalp, I purposely transplant much, much tighter recipient patterns on them such that we can achieve a uniform density from front to back. People that may have narrow color contrast, like blonde hair on Caucasian scalp or African descent hair on African descent colored scalp, I don't need the same density pattern in my recipient sites to lead to what would look like a normal density pattern in them. Again, one of the big benefits of having a consultation, we discuss all that with you.
Okay. And then the next question we have here is, do you have experience working with African American hair? I know our hair can sometimes require a different level of care, so I wanted to ask whether you'd feel comfortable working with my hair type.
Yes, over the years, I've transplanted uh, many people of color. Uh, uh, my family contains many people of color, and I've transplanted some of them. And my bad joke is every time we get together for a family event, they still talk to me because they're really happy with the result I got for them. But yeah, the harvesting techniques are different. Um, it's important to ask people of color who may have a higher tendency for the development of hypertrophic or keloid scarring or pigment changes with scarring. We cover all that with you in the consultation so we can develop a plan. And ultimately, depending on what the patient's goals are, um, we determine whether we would do the FUT procedure or the FUE procedure. If we're going to proceed with the FUE procedure, it's a slow grind of a process when we transplant people of color, specifically because the rubber meets the road with getting good quality follicles, and because of the curl of your follicles, for example, which may be different than less curl with me. There it's a little bit more time consuming to extract, but yeah, that's something that I feel comfortable with.
Okay, next question, and a pretty common one. Approximately how long after the transplant will I be able to go back to work without someone noticing the redness?
Okay, so so when we transplant, let's say I'm transplanting this frontal cup area here, fairly common area, reestablishing a hairline and adding density like in this area. There's going to be redness to that area of the scalp. If we do a long hair procedure, people can use their hair to camouflage that fairly easily. If we do an FUE, a large FUE procedure, and so we're going with a short haircut, it's probably going to take on the short end a week and on the longer end 2 weeks for the bulk of the residual redness across the transplanted scalp to resolve itself. People will ask me, well, what can I do in the interim? And what I tell them is get before your transplant, put a baseball cap on backwards We know that this area is going to get red afterwards and get a little bit of redness in your face a few days before the transplant. So the redness from the sun blends right in with the redness of the recipient scalp that we transplant, and they both kind of fade away together. Those short-term concerns are very, very common pre-transplant. They're very rarely a concern post-transplant.
Okay, what about, while we're on the subject, swelling?
Yep. Um, you can develop puffiness on the forehead for up to 5 days after a transplant. It's really easily managed with a cool pack. If you read the book on hair transplants, it'll say that about 15% of people will develop mild forehead edema. Again, easily managed. I had a patient recently that was frustrated with me because 4 days after his transplant, right in a tiny little area right here, he developed a little puffiness. And we just put a cool pack on it intermittently over the course of the day, and it was resolved by the next morning. Those, again, are all short-term things that are really easily managed.
Okay, and what about wearing hats after the procedure?
Um, so, so when we do our procedures, you're with us all day. We don't rush the procedure. It's important to you that we don't rush the procedure. It's important to us for you to do the work the right way. And I kind of tease the patients at the end of this long day, and I say, it took us all day to get them to where we want them to be. Let's let them glue in over the next 5 days, right? So I tell people, I'm okay with a baseball cap. If we can go 2 or 3 days without even having anything over the top, that's ideal. But if your best buddy calls you tomorrow morning and says, hey, I need your help with something, I have no problem with you putting on a baseball cap. Go help your buddy, come home, take the baseball cap off. I don't like hoodies. I don't like those winter ski cap things, those beanies that people wear because of the rubbing. But I allow that about 8 or 9 days after the procedure, anything goes.
Okay. And then on that same subject, when are patients allowed to work out again, get back to normal daily activities?
Well, you're back to normal daily activities as soon as we're done with the transplant. Again, it takes the average patient about 5 days for the follicles to really be secure. And so I tell people you can and should do normal routine things. You're not an invalid after a hair transplant, but we want to be cautious in doing those normal things to not crank our metabolism up, especially in the first 4 or 5 days. So what I tell people at the end of the transplant is, like what is today, Wednesday? So I'd say 1 week from tomorrow, a week from Thursday, you can resume unlimited physical activity. Starting from right now till a week from tomorrow, you do normal things, but we don't do them to the point, especially in the first 5 days, where we're cranking the metabolism up, which theoretically could push and elevate on some of the follicles we placed. Let them glue in.
Okay, what about traveling for work or traveling in general, flying?
No issues.
Okay, perfect. Um, okay, here's one. As a woman, if you have overall fine aging hair due to alopecia and perimenopause and have receding hairline, will the hair transplant still provide results?
Yes. I met with a lady recently. She asked the same set of questions. And it'll help if we get together so I can look at you as an individual and we can come up with a game plan that works. But what I told her is that if we can use something just to help your fine caliber hair increase its shaft diameter, you may not even consider having a hair transplant. If you wanted the female hairline reconstructed secondarily, then we would address that secondarily down the road. So it really comes down to what the primary goal is for that patient. Again, we can get a better understanding of what that primary goal is at the time of the consultation. And once we understand that, we can create a game plan for that individual to start with, be it a hair transplant or not. And then if we can achieve that goal, we then may be able to address down the road a secondary goal like reestablishing a female hairline.
Okay, next question. In regards to showering, washing your hair after the procedure.
Yep. So we're going to keep it real simple. I like to keep everything real simple. So you're confident after the transplant. And so the day after the transplant is what I call your day off. And there's only a couple of things I want you to do on your day off. And I outline those for you, but I call it your day off, the day after your transplant, meaning no shower, no shampoo that day, so that we're going to give that day just for the follicles to start to secure themselves. The day after your day off is when we start showering and shampooing. I use a method that's super simple and super effective. And I outline with you that with you. Well, I mean, we could give you my post-transplant instructions, for example, but it's something that I outline with you at the end of the procedure, something that I want you to be confident with so that we can turn you around, so to speak. But you start showering and shampooing like 48 hours after the transplant. And then you're completely back to normal, shower and shampooing like this again, about 8 days post-transplant.
Okay, I can go ahead and answer this one for y'all. Is there a fee for the initial consultation, and who can you talk to about scheduling that? So there's not going to be a fee with either one of us. You can do a consultation with myself or with Dr. Reese. We also have a couple other cosmetic consultants available within the company. So we're going to send you an email after this webinar for attending, and you can reach out to me directly, and I'm happy to help you schedule with either myself or Dr. Reese. But in general, we do not charge for consultations. And then cost is going to range somewhere from, I would say at the lowest, about 10,000 to 15,000, with an average case being around 13,000, 12 to 13. Okay, and let's see here. Is it possible that after the hair transplant, the new hair remains as baby hair and never fully grows in?
Before we get to that question, I want to say one thing about the pricing. This is important, is that 75% of people that I transplant once. And that's good for them. I want them to get their result and then maintain their result. Over time, hair restoration, the transplant that I did, ends up being by far the most cost-effective solution for you. If, for example, you started doing extensions or wore a topper or a wig or a toupee, any of those options, you'll pay $5,000 to $6,000 a year every year compared to a one-time procedure with me. Over time, it is super cost effective, but more importantly, because you feel more comfortable with the result, you get to enjoy that result, and it really makes a huge difference for people. Now, that other question about what was that other one?
Yes, the question that we went over was, is it possible after the hair transplant that the new hair remains as baby hair and never fully grows?
So, no. The hair over a course of a year will end up growing as this hair does here. But there's strategies involved in the transplant process, meaning that if we're reconstructing a frontal hairline or a frontotemporal hairline where the hairs naturally grow on the finer side, I'm specifically going to harvest areas of the scalp that will grow hairs on the, a little bit on the finer side, and we'll dedicate those to those areas. There's other areas behind where we may naturally want a little bit more density, and we harvest areas of the scalp where that naturally grows hair that's coarser. So those are things that we take into consideration on every case that we do. And we can kind of custom create that based on the natural shaft diameter of that patient's hair, to creating density patterns to offset what that patient has as far as density, looking at their color contrast, looking at whether they have straight, wavy, or curly hair. We put all those things into consideration to come up with your plan. And that's why not everyone does that. Some people will say, yeah, I'm this, that, and the every, and then they only harvest from the occiput. Big mistake. You've got to come up with a plan that's custom made for that person's situation.
Okay, next question is, I like to wear my hair short. Is it possible to still wear it short after a hair transplant without people seeing scars on the back or side of head?
Yes. So a couple of things. It depends on what the definition of short is. If you're talking about like basically shaving, then you'd probably want to lean more towards the follicular unit extraction technique, where each little follicle that we take out, it's a diffuse pattern over a much larger area of scalp. But if you had, average density hair and you were going to wear your hair, if your definition of short was a half an inch or 3/4 of an inch, then easily you could end up with the strip method, possibly the strip technique with combined with follicular unit extraction. Again, we do that long hair. It's a beautiful, elegant procedure, heals incredibly well. And one other trick as far as the FUT procedure is that in patients that have that wide color contrast, the dark hair, the light colored scalp, um, I like to close those with a technique called a trichophytic closure. And basically what that means is that we encourage the hair to grow right through the closure, where it visually breaks up any evidence that we were there doing anything. But when I do the FUT procedure, you're talking about like a millimeter, maybe 2 millimeters at the most of width of those incisions. And if we get the hair growing through it there, I mean, you can wear your hair short. As long as if it were like shaved, go with the FUE.
Okay, and then is there a promotion for attendees? So we are doing $1,500 off if you have your consultation in April, and then you are able to book the procedure by the end of May. Okay, and let's see, anything else? I think that's pretty much it as far as questions go right now. Is there anything else you wanted to add in?
No, I guess if I was going to say, if you take away anything from this, it's this one concept. And that is that you've probably heard in your life that you get what you pay for. And in the hair transplant field, that is absolutely, positively the truth. Probably 20-25% of my practice over all these decades that I've been doing this work has been doing what we call corrective hair transplants, meaning that somebody went to, let's say, my competitor because they offered them $500 less. That could end up being the most, I tell people the inexpensive hair transplant could end up being the most expensive hair transplant that you ever have, because many times it's going to need to be corrected. And then you'll come to someone like me, and we correct them for people, and they're so appreciative for our work. We've helped a lot of people over the years with corrective work, but we don't want you to be in that situation in the first place. Um, I think that the best thing to do is to have a number of consultations. You'll end up feeling a comfort level with each of the people that you meet with. And if you decide that this is what we offer is the right option for you, then you'll move ahead with who you feel comfortable with.
Okay. Everybody is going to receive a link to their email after the webinar. So within that link, y'all can book a consultation again with either myself or Dr. Reese, and we can answer any other questions specific to you at that time. But thank you so much for joining us.
Thanks very much. Appreciate the opportunity.
All right. Y'all have a great day.